It's important to clarify that autism, or autism spectrum disorder, is not something that can be cured. Instead, individuals with autism can benefit from various interventions that help them navigate daily life and develop skills. Here's a more detailed overview of effective approaches. 1. Behavioral therapies. Applied behavior analysis, or ABA, is one of the most researched and commonly used therapies. ABA focuses on reinforcing positive behaviors and reducing negative ones. It involves breaking down skills into smaller, manageable steps. Cognitive behavioral therapy, or CBT, can help individuals manage anxiety, depression, and other co-occurring conditions by changing negative thought patterns. 2. Speech and language therapy, communication skills. Development involves speech therapists working on improving both verbal and nonverbal communication. This can include teaching sign language or the use of communication devices. Social communication interventions focus on improving conversational skills, understanding nuances in language, and enhancing pragmatic language use. 3. Occupational therapy. Daily living skills are developed with the help of occupational therapists, who assist individuals in tasks such as dressing, eating, and personal hygiene. Sensory integration. Therapy is also crucial, as some individuals with autism may have sensory sensitivities. Therapists can provide strategies to help them manage sensory overload. Social skills training, peer interaction. Programs designed to teach social skills through role-playing and group activities can help improve social interactions. Understanding social cues. These interventions often focus on recognizing body language, tone of voice, and other nonverbal signals. Educational support. Individualized education plans, or IEPs. Schools can create tailored educational plans that address specific learning needs and goals. Inclusive education. Involving individuals in mainstream classrooms with appropriate support can enhance social interaction and academic achievement. Medication. While there is no medication to treat autism itself, medications can help with related symptoms like anxiety, ADHD, or depression. It's essential to work with a healthcare provider to find the right medication and dosage. Parent and family support. Providing families with knowledge about autism can empower them to support their loved ones effectively. Connecting with other families can provide emotional support and shared resources. Alternative and complementary approaches. Some families explore dietary changes, although research on their effectiveness is limited. Practices like yoga or meditation can help manage stress and improve overall well-being. The goal of these interventions is not to change the individual, but to provide support and tools that help them thrive. Each person with autism is unique, so it's vital to tailor interventions to their specific needs. Always consult with qualified professionals to develop a comprehensive support plan.